Ankle anterior approach. This provides exposure to the distal tibia, ankle joint and talar dome. Indications include ORIF for the pilon fractures, ankle arthrodesis, total ankle arthroplasty, incision drainage of infected ankle and removal of loose bodies. Intermuscular plane is extensor hallucis longus and extensor digitorum longus. This is the intermuscular plane as both are supplied by deep peroneal nerve. Anesthesia is general or spinal. Position supine. Tourniquet can elect for partial insectuations, can allow better visualization of neurovascular bundle. So don't need to put it complete. Approach. Make 15 cm incision over the anterior angle. Begin 10 cm proximal to the ankle joint. Cross the joint midway between the malleoli. Stay superficial to avoid injury to the superficial peroneal nerve. Branches. Superficial dissection. Incise the deep fascia of the leg in line with the skin incision. Incise extensor retinaculum. Find plane between the extensor digitorum longus and EDL and EHL. A few centimeters above the ankle, above the joint. Identify neurovascular bundle. Mobilize tibialis anterior artery and deep peroneal nerve. Retract EHL and neurovascular bundle medially. Retract extensor digitorum longus laterally. Neuromuscular bundle towards the medial. Remaining joint capsule tissue cleared to expose anterior ankle joint. Deep dissection. Incise the capsule of the ankle joint in line with the incision. Expose full width of ankle joint by subperiosteal and subcapsular dissection of the tibia and the talus. Medial variation can be 15 cm incision anterior to the medial malleolus. Incise deep fascia to medial side of tibialis anterior tendon. Retract tibialis anterior laterally to expose the ankle joint. This is a medial variation in which you make the incision anterior to the medial malleolus and incision is deepened medial to the tibialis anterior. Retract tibialis anterior laterally to expose the ankle joint, but less exposure is there. Danger is superficial peroneal nerve, which has greater risk during the skin incision, and neurovascular bundle, deep peroneal nerve and the anterior tibial artery. Above joint runs between this neurovascular bundle runs between extensor digitorum longus and extensor hallucis longus. Cross behind extensor hallucis longus at the level of the ankle joint. So the neurovascular bundle above the joint runs between extensor digitorum longus and extensor hallucis longus, while at the level of ankle joint it is behind the extensor hallucis longus.